Welcome back. I can't wait for this next one. It's time to talk about something that I personally feel gets neglected way too often in the conversation. Black women in healthcare. Here's the Roundtable.
Hi everyone, welcome back to the Roundtable. I'm Nzinga Barnett.
I'm Ivana Bolanga.
I'm Kayla Davis.
I'm Brianna Johnson.
And today we're going to be talking about Black Maternal Healthcare Awareness Week. This week was recognized last week by a nonprofit called Black Mamas Matter, and we're also going to be discussing different disparities in healthcare that disproportionately affect Black women and other causes and effects of these issues. What do you guys think?
I mean, not only are there a lot of factors that affect Black women's healthcare in our healthcare systems, but I think we really need to be looking at these societal factors that also contribute to poor Black maternal health. Racism and sexism, it really boils down to these systemic barriers that are contributing to this poor maternal health and, making it so that they don't have equal access to resources.
That's really true, but what do you guys think about people that say, oh, Black women aren't the only people dealing with these issues, Black women aren't the only people losing their babies or having healthcare complications? What about other women? It can't all just be about focusing on Black women.
Yeah, well, while that's true that, of course, white women are affected by these types of issues, according to the CDC, Black women are 3 times more likely to die from pregnancy-related complications than white women. So it's in the statistics that this is clearly an issue that needs to be addressed nationally by the White House. As far as fixing the issues when it comes to the discrepancies in healthcare for Black women.
Absolutely, and infrastructure has a lot to do with that because in Black communities you see so many neighborhoods flooded with fast food restaurants, and where do you get like your fresh, affordable groceries? I think that's another conversation that has to be had in policy changes because it's almost as if they want us to be consuming these things and be predisposed to diabetes and so many other health issues.
Yeah, that's true. And I mean, we also see a lot of Black women in response to these issues turning towards things like Black doulas and midwives to help them through their pregnancies and other journeys as they're trying to give birth and honestly have a more healthy experience.
And because we have to go out of our way.
Exactly.
Instead of things being set in the government to where we have access and we don't have to find things on our own.
Right, exactly. But I do want to say the White House is doing something. So there was an act that was passed in 2020 that acknowledges this. It's called the Black Maternal Health Omnibus Act, and it introduced 12 bills to basically address the gaps in policy when it comes to these maternal health crises. So they have already passed 2 of the bills, and one of them is to strengthen the maternal care to protect veteran mothers, and another is to address the racial and ethnic biases in healthcare services. So we're making some type of progress. It's being addressed, which is good, and specifically $200 million has been put towards implicit bias training when it comes to healthcare providers, which is really the first step into fixing these issues when these Black women are coming into the hospitals and they're ready to give birth and they're not addressed as having as much pain as white women, or they're not given the health care that they really do need in those moments.
Yeah.
So
it's really scary as a Black woman going into the hospital and having to worry whether or not they think you have a higher tolerance than another race.
Or being taken as serious.
Yeah. Right. So I think what we really need right now is a multifaceted approach to this issue, one where we're looking at Black women's health across their entire lifespans, one that's ensuring equal access to quality health care, and one that's really observing these societal factors that affect our health.
For sure.
Absolutely. I completely agree, and I think that these are all great points and great ideas on how we can all play a role and do our part in giving Black women a more equal opportunity and better experience in their maternal journeys. Thank you for watching this episode of The Roundtable, and we'll see you next time.